This conference will now be recorded.
I'm going to try that one more time. Good morning, everyone. I'm Melissa Morin, Public Information Officer for the Whatcom County Health Department. Thanks for joining us for Whatcom County Health Department's media briefing for today, Monday, November 23rd. Today, we're going to be hearing from Erica Lattenbach, Whatcom County Health Department's Director, and Dr. Sudhakar Karlapudi, Chief Medical Officer for Peace Health Northwest. As we get started, just our usual reminders here. Please go ahead and mute yourself. We will open up the opportunity for questions once we've heard from both of our speakers. And at that time, we'll invite any members of the media to type your name and affiliation into the chat, and we'll call on you to ask your question in the order that those are rolling in through our chat feature. And one last reminder, again, this is being recorded and will be available online later today at the Whatcom County Government's YouTube channel and also on our media page at www.whatcomcounty.us/COVID. And with that, I'm going to go ahead and turn things over to Erica.
Thank you, Melissa. Thanks for joining us. We have some important information to share with you, and really glad that Dr. Karlapudi has joined to talk about hospital capacity and medical surge. But before I turn it over to Dr. Karlapudi, I'd like to just go over some of the most recent data and some information about testing. So as I'm sure you all know, our disease activity continues to climb. And the most recent data, which is the official count, shows us at 84 cases per 100,000 over 14 days, but the preliminary data for the 2-week period ending November 19th shows us at 130 cases per 100,000 people, which is more than 5 times higher than the threshold in order to move between phases. This is also the highest case per 100,000 that we've ever seen in Whatcom County, including the early surges and the summer surges. So very concerning to us. Our case rates remain lower than some of the other counties in our region, but I think there's a couple of important reminders around that. What we are seeing is our trends in our disease line in terms of cases is trending at the same level, or even more a steep trend curve. So we are behind other counties, but we are headed in that direction, in the same direction that they are if important changes aren't made and we aren't able to curb the spread of this disease. We had been fortunate for weeks when we were seeing cases rise in counties around the Puget Sound region, and we were not seeing those increases in Whatcom County, and now we are seeing those same trend lines for us. We are just a few weeks behind other counties. It's also important to remember that the impact travel can have on spreading the virus throughout our region and state, as we see those very high rates of disease in other areas around the state and then around the region, that there is higher potential when going to those places just by nature of the prevalence of the disease. That folks can contract the disease, both in Whatcom County and certainly around the state and around the region. And I think, we've been talking about this a lot, but it's just a good reminder to stay at home this Thanksgiving, to celebrate with just household members. We are all very adept at using Zoom and other platforms, and that is really the safest way to connect with family, especially family that is in high-risk categories or have pre-existing conditions. So just a reminder for that. We are concerned about the cases currently and about the cases we may see following Thanksgiving and travel if that does occur. We are seeing case rates highest among age groups 18 to 59 and significantly lower for those over 60 years old. And our positivity rate has been changing over the past week in terms of percent positivity of tests, excuse me, from just over 1% to nearly 4% for the week ending last week. And I think that is, it's not rising because we are not testing as much. We are actually testing concurrent to the rise, with nearly 1,000 more people tested the week ending November 14th than the week ending October 31st. So what that indicates to us is there is just more disease in the community that's being identified through testing, but there is more disease spread and more transmission in the community. Now, with regard to testing, we did announce last week that our mobile testing site has reached its maximum capacity. We've had to overbook some days in order to get folks in who were symptomatic or were known close contacts to cases. And we're really urging people to forego tests for travel or gatherings and instead stay home to free up testing slots for the people that really need to know their status, those people who are symptomatic or close contacts of confirmed cases. And testing capacity isn't only a concern for our county, but is maxing out across the state. You may have noticed that the numbers on the state data dashboard did not update yesterday, and that is a direct result of the overwhelm of our testing facilities, so like Northwest Labs and other testing facilities around the state, as well as the state database systems in processing all of those positive and negative tests. It is truly overwhelming all of our systems, the amount of testing that is occurring in our state, not just in Whatcom County. We will, with regard to testing also, we will be moving our testing site to one location. We've been in locations all over the county, and we will be moving for the winter to one location. It's at the Linden Fairgrounds, and we made this decision because our staff have been outside during this cold and rainy weather. We needed to get them indoors, and there were specific requirements for a testing site that were important, like having power, water, ability for people to stay in their cars and actually drive through a facility, having bathrooms, and sufficient parking and queuing for people who need a test. And there were very few sites around the county that fit all of those needs. So the Linden Fairgrounds emerged as a site where we can have just continued testing and ensure that we're keeping our staff safe, but also that we can limit or hopefully eliminate the need for canceling testing on days with adverse weather by moving it indoors. So for those reasons, this site emerged as the best location around the county, and that will be our sole site throughout the winter for testing. So with that, I want to turn it over to Dr. Carla Pudi to talk about hospital capacity and surge planning.
Thank you, Erica and Melissa. I hope you guys can see and hear me okay. Thank you for inviting me to this presentation. My name is Sudhakar Karlapudi. Two very difficult names. Most people just call me Dr. K. I'm the Chief Medical Officer for St. Joe's Hospital in Bellingham, United General in Skagit and Peace Island in San Juan County. So I get the pleasure to serve 3 different hospitals. I want to share with you just three topics today. The first topic is about hospital capacity and where we are with our COVID patients. St. Joe's is licensed and staffed for 241 beds. On any given day, St. Joe's has a capacity of 85 to 90% full because we are also a regional hospital, so we take patients from a lot of other places. So any other day, even pre-COVID, we would be at 85 to 90% capacity. Today, in the hospital, we have 18 patients who have COVID. A week ago, we had 5. So in the past week, we have seen more than almost a fourfold increase in COVID cases, which reflects the increase in patients and in people who are turning positive that Erica referred to. So we are seeing that surge within the hospital. So in a hospital of 241 beds, when we have 18 patients, how does that impact us? On any given day, St. Joe's is taking care of a lot of patients who come with strokes, heart attacks, pneumonias, um, stomach problems. So we have a lot of patients who need us. So any given day, we are seeing a lot of patients who are not just COVID positive. When we have patients with 18 beds, we are currently in have plans and structures in place. So we have 22 beds that we have allocated for COVID patients, and we have plans to expand progressively to larger numbers if we need to. Essentially, we have to expand capacity in a way to make sure that patients who are COVID positive are geographically not connected with patients who are COVID negative. So creating a physical barrier. And when we have to do that, we have to take chunks of hospital and more number of beds than the number of COVID positive patients we have. So therefore, we have 22 beds right now dedicated for COVID patients, even though we have only 18 patients in house. And that's something we have to do to make sure we have physical barriers. So in order to maintain capacity and serve Whatcom County with all the other medical problems we have, and I forgot to tell you, trauma, we are the only level 2 trauma center for the county. We need to keep a lot more capacity than we have now. We have 34 ICU beds, and we can expand a lot more to that. We can go up to 43 ICU beds because we have ventilators, 43 ventilators. We have well-qualified nursing staff, physician staff, respiratory therapists who can manage that. And in case we get beyond that, we still have plans in order to bring more equipment and more expertise in order to take care of those patients. So that's our current capacity with the hospital. The next topic I wanted to talk to you about a little bit is the disease itself. We have been in this pandemic for about 9 months. And even today, I get asked, why is this disease so different than the common flu? So here's my understanding to differentiate between why this disease is so different from the common flu. We, as human beings, have existed with flu for hundreds of, or even thousands of years. This disease we have only seen for a year, which means that we essentially have no immunity till we have that vaccine that we can get and get the immunity to it. So no immunity. Second, this disease has a higher mortality than flu. To give you perspective, from the start of this pandemic till today, COVID-19 has killed more people in the US than flu has killed in the past 6 years. And if this disease trends within 2 weeks, COVID would have killed more people than what flu has killed in the last 7 years. So this disease has a significant higher mortality than flu. And the third difference, we are still figuring out what are the long-term effects of this disease. There are many healthy young people, some of who are Olympic level athletes, who months after getting the disease still are not back to being themselves. So there are long-term effects to this disease that we don't understand. And just that's a quick update. And maybe the other thing I wanted to touch upon is this disease uniquely affects multiple organ systems. This disease has caused kidney problems, heart failure, has affected blood vessels in people, which typically we do not see with the flu. So that's why this disease is so dangerous, and we are seeing the impact of this disease in our community and in our country. The next topic I wanted to talk to you a little bit about is about what can we do to prevent or curb the surge of this disease as we look to our upcoming holidays. I often remark that this is the COVID-19 virus is not a smart virus. We are a billion or trillion times bigger than this virus and can think much more complexly than this virus. This virus essentially depends on two things. It depends on a breakdown in our habits, and it depends on us being social creatures who want to connect with our loved ones. So what do I mean by that? So essentially, when we have a break in our habits, face washing, hand washing, touching our hands to our face, touching surfaces. These are all habits that we as human beings have. So when we do not have good hand hygiene practices, that is what brings this disease to us. Door handles. So what do we touch and what we, how it comes to us. The second way it comes to us is because we are social animals and we want to interact with each other. It's very important for us to connect. It depends on us to get physically close to each other so it can spread between us. So this holiday season, the challenge for us that we can absolutely overcome is how can we connect with our loved ones without getting into that physical space so we do not transmit the disease to each other. So as Erica said, let's use technology. Let's leverage FaceTime. Let's leverage Zoom so we can connect, make those connections during this important time of the year, and find that connection with our loved ones and still stop the transmission of this disease. So those are the 3 things I wanted to share with you, and happy to take any questions. And once again, thank you for inviting me here. Back to you, Erica.
Melissa, did you want to start with the questions?
Yeah, absolutely. We can hop into that. Erica, did you have any other anything about surge planning that you wanted to share with folks?
Sure. Yes, I can add a little bit that we are in regular contact, of course, with Peace Health. We have weekly meetings, and that has been very helpful to share data and information. We're also in regular contact with the Northwest Healthcare Response Network to understand what our regional capacity is and to ensure that, if possible, there will be regional sharing among hospitals to help accommodate the increases in patients. So. And if there's anything you'd like to add about that, you're intimately involved as well, Dr. K.
Sorry, Erica, I missed the last 2 sentences. I'm having technical
That's
problems.
okay. I was just sharing about what we're thinking in terms of surge planning and how we're working with you in the Northwest Healthcare Response Network on surge planning. Yeah, these are not county by county dependent. We're really thinking about this as a system, as a hospital system, rather than each county on its own. So we're all trying to work together, and certainly Peace Health having locations all over our region is helpful for us as a county to have that perspective.
All right, thanks for sharing that perspective. We're going to go ahead and open things up for questions now. So again, if you'd like to ask a question, we're inviting members of the media to go ahead and type your name and affiliation into the chat, and we'll call on you to ask your question in the order that those come in. Looks like our first question here is from someone with Saturday Morning Live on KGMI. If you want to go ahead and unmute yourself and ask your question, you're welcome.
Hi, yes. My question is in regards to overall positive tests versus overall testing. Whatcom County total so far is 0.0215%. The state of Washington is 0.048%. Realizing that in Whatcom County the last 2 weeks it has increased. Positive tests versus overall testing is at 27%. But according to the CDC, there's a 66% rise in youth mental health cases, which are being seen nationally and being admitted into emergency rooms. So in this uptick in positive testing is showing that a lot of young healthy adults are getting this, some of them asymptomatic, which is helping to spread the virus and develop community immunity, which essentially should help to protect the public, from what I believe. So my question is, when will the fallout or the consequences of the virus lockdowns, the shutdowns, the isolations, for mental health issues, substance abuse, joblessness, homelessness, when are those going to become more important and override the virus itself? And isn't that going to help with medical capacity as well? Whoever wants to answer it.
This is Sudhakar. I can answer from just the pure medicine side of it. I think your question is very, very important, and it talks about policy. I'm not the expert on that, but I'll definitely tell you about the health impact of that. Your statement is absolutely correct. We have seen a significant increase. No, I wouldn't say significant. We have seen an increase in patients requesting mental health needs in our community than we have seen before, and it's nationwide. But we have seen a significantly more increase in COVID patients that's taking up inpatient capacity. Another thing to not lose sight of is, as during the early stages of this pandemic, there was at least a 20 to 25% decrease in strokes and major heart attacks that came to the hospital, which essentially was people were the disease is continued, so they're having their they were having other healthcare problems that was having major impacts on their life, that they did not have capacity to get into the hospital, either because they didn't come in or the hospital didn't have capacity. Thankfully, not for us in Whatcom County, but that's something that happened nationally. So I think what we are seeing right now is serious mortality and morbidity because of COVID. We are also simultaneously seeing mental health needs that are rising because of maybe some of the countermeasures for the virus. So far in Whatcom County, we've been able to find that balance. I just don't know how to address it from the policy standpoint. I'll leave that to the other experts in the call.
Okay.
Yeah, I guess I'll just echo, you know, Dr. K and I are both in helping fields, and it is very challenging for us and for me as a public health professional to make decisions that I know will benefit people and will save lives and will reduce the level of suffering, knowing that there are also side effects that will have those impacts. And these are difficult choices that we're all trying to make in order to reduce the number of deaths and severe illness that we can in the short term until there is a vaccine. And believe me, none of these are easy choices. We know that there are severe consequences for people, as Dr. K was talking about. It will never become easier for humans to not interact with each other and to not feel connection. You know, when we talk about public health measures, when you quit smoking, it's very hard for the first few weeks, and then you develop new habits and it becomes easier. It will never become easier for us to not be around our family and friends. And that has serious implications on mental health and substance abuse and other issues. But right now, we are trying to save lives from COVID, and knowing that these are hard choices and there's no good answer here. So I just want to share that as well.
Erica or Dr. K, having been keeping track of the COVID stats for Whatcom County, I mean, I've pretty much seen a flat line on deaths from COVID, thankfully. But can anyone explain why thus far there is only one reported case of seasonal flu in the entirety of Washington state? And how does the science connect those two and the coronavirus, please?
I can take a first shot, and Erica, you can chime in if that's okay. So typically, the flu season, and we start to see a rapid increase in flu after the Thanksgiving holidays, and then you get in after Christmas and New Year. So I think for the flu season, I've been watching the same CDC website that you have been referring to. The flu season is being it's too early in the flu season for us, I think. I think also some of the measures that we have put in place, especially with social distancing and personal habits, hand washing and not touching our faces and masking, might be helping. We definitely did see that very early in February and March, we saw a decrease in influenza when we implemented those social distancing measures. So it is possible that we are still early in the seasonal flus in the Washington state, and therefore our numbers are low. So that is my current thinking around why the numbers are so low.
Thank you.
Yeah, and I'll just add that, in addition to the social distancing and not touching face and washing hands measures, which are protective against all disease, we have seen higher percentages of people getting a flu shot this year than we've seen in many years. So more people are protected against the flu this year as well.
Our next question is from Robert Mittendorf with the Bellingham Herald. Robert, go ahead and ask your question. Looks like Robert might not have access to his microphone. So Robert's asking, we're seeing pushback against quote unquote lockdown limits among some elected officials. Have you been in touch with them to discuss messaging?
Thank you for the question. Yes, we're actually going to hold a briefing for elected officials about this issue today. I think it's, and if I may just take the liberty to share a little bit about our perspective on this, you know, because Whatcom County was, I have a tickle in my throat, I'm sorry, because Whatcom County was behind the curve from compared to a lot of other counties, we are hopeful that the sort of lockdown or restriction measures will have a disproportionately positive impact on our county because it has not reached an exponential level. But it's also challenging because if you happen to not be paying attention to the numbers last week, you wouldn't actually know that we were surging the way that we are. So that's a really challenging messaging wise for the public. That said, we understand and appreciate the early action that the governor took in order to eliminate exposure sites for additional spread. And it is, again, it is not without some incredible sacrifice and some real challenge for our community, people who are going to be laid off, businesses that may or may not be able to open again. These are all really difficult choices, as I said before, but the governor did identify with the State Department of Health some of those exposure sites that are most prevalent in terms of spread of the disease.
We have another question from Robert. He's asking if we are getting complaints about violations as well.
We are. We're getting a lot of complaints about violations, and for the most part, the state LNI and Liquor and Cannabis Board are working through those complaints. So we are kicking them up to the state for some of the more severe violations, and we're handling some of the more minor violations. But we are getting a lot of complaints.
Thanks, Erica. Our next question is from Key Relia with the Herald. Key, if you can unmute yourself to ask your question, please go ahead. Looks like Key's unmuted, but we're unable to hear you, Key. Do you want to give it one more try? Okay, I'll go ahead and ask Key's question. Key's asking a question for Erica. Are new cases still from private gatherings?
The majority of our new cases are from household contacts and social activities. And I think this is where when we talk about private versus public, there is, and this is where the governor's closures came from, is whether you're sitting around a table with friends at your home inside with no masks on for a period of time and having a meal together, or you're at their home doing the same activity, or you're at a restaurant. That is considered a social activity, and it's spread between individuals. So that is the challenge with restaurants, is it has all of the ingredients necessary for effective transmission of the disease. It is indoors, it is people not wearing masks, it is being in close proximity, and it is being together for more than 15 minutes. And so those are the areas, and no matter what the setting is, those are the ingredients for spread of the disease. So we are seeing mostly social and mostly household, because that's where all of those ingredients continue to be a challenge.
Thanks, Erica. And we do have a question that's come in related to the protest being conducted at the library and City Hall. Erica, we're wondering if you can speak at all to the health department's response to the protests there.
Sure. I know that the city of Bellingham is working closely on this. They have consulted with our environmental health staff about this sort of health and safety measures of the encampments around City Hall. But the city of Bellingham is taking the lead on that particular issue.
Thanks. And one question here from Jeff with Como News. Jeff, go ahead and unmute yourself to ask your question.
Yes, I guess you mentioned lockdown violations. What have been some of the major ones that you've had to deal with? Then I have a follow-up to that.
Sure, we're seeing in select situations, restaurants staying open, gyms staying open, some of those facilities that were ordered to reclose that are staying open. We're also seeing the capacity measures, having 25% capacity not being adhered to. So those are kind of the major buckets that we're seeing in terms of violations and complaints.
How are those enforced?
There isn't a formal enforcement mechanism. However, for those businesses that are remaining open that were ordered to shut, we are sending those to the respective state agencies that can do more enforcement than we can locally.
And then finally, you mentioned the lawmakers. You've got a briefing with some of the elected officials coming up. Has the messaging from some of the lawmakers, particularly in your area, I'm thinking of Doug Erickson, who has been opposed to a lot of these lockdown measures, a lot of these measures to stop COVID-19. Has the messaging from certain lawmakers made it difficult for you to do your job?
We're all making difficult choices, and we're all using different risk assessments and different sets of information in order to make the decisions that we are making. So, of course, we would benefit from a universal response that mirrors that of public health and our hospital partner. But we do recognize that these are all difficult choices. It's all in the gray area at this point. So we are working to try to make sure that we offer our perspective and the information that we have to our elected officials.
All right, it looks like that concludes the questions that we have received. So with that, we'll go ahead and end things for today. Thanks everyone for joining us.